What is the traffic light system?
The COVID-19 community traffic light system tells people what they should do to lower the risk of getting COVID-19 or spreading it to loved ones. The traffic light system is an important part of our response to COVID-19 now that the declared COVID-19 public health emergency has ended. The traffic light system has 3 levels: green, amber and red. When the traffic light is green, Queensland Health recommends you should stay home if you're sick, keep up to date with vaccinations, take a rapid antigen test or a RAT test if you have symptoms of COVID-19 and register it on the website if you get a positive result, and wear a mask in healthcare settings or other settings if you're asked to. When the traffic light is amber, Queensland Health also recommends that you wear a mask in healthcare settings or indoors if you can't socially distance, on public transport, and if you are older or around vulnerable people who are at risk. If you consider yourself at a higher risk of COVID-19, you can ask people around you to wear a mask. And you should take a rapid antigen test, a RAT test, every 2 days if someone in your household has tested positive to COVID-19. When the traffic light is red, as well as the other steps we've already talked about, Queensland Health recommends that you should wear a mask indoors. Businesses and venues can make their own rules to keep their workers and customers safe from COVID-19. This includes NDIS and other disability service providers. For example, GP clinics, pharmacies or allied health settings may require you to wear a mask to enter the building even if the traffic light is green. If you or someone you care about and care for considers themselves to be at higher risk of COVID-19, the best thing you can do is to be vaccinated, wear a mask and keep your hands clean.
Why do we have a traffic light system and how do they decide when it moves from green, amber and red?
The traffic light system was put in place to support the community against COVID-19. The traffic light system provides advice to the community and business to help lower the risks of COVID-19, especially when a lot of people in the community have the virus. Queensland Health decides when the traffic light will change colour depending on the number of active cases, how many people are in hospital and how quickly the virus is spreading through the community. The Chief Health Officer considers all of the above when making a recommendation to the Director General of Health about whether to change the traffic light colour.
We keep hearing that the public health emergency has ended. Can you tell us what this means?
Even though COVID-19 is still a risk, it is no longer an emergency. Now we treat COVID-19 in much the same way we treat other diseases. We did this because we are now better prepared to respond to COVID-19. Many people are now vaccinated. The Omicron variant is less dangerous. We have antiviral medications and our health system is ready to help people who need it. When the public health emergency declaration ended, so did our public health directions. That means that some of the rules about vaccination and isolation have changed.